Catherine Taylor. I'm Clinical Practice Manager at Erie Shores HealthCare. Every morning I wake up and I look at Lake Erie, which is beautiful. I literally hear the waves crashing on the beach. I usually pour my coffee into my travel mug and get into my car. Once I'm driving, it's all like small rural roads. I pass like a few schools on my way, lots of people walking their dogs. When it comes to nursing, you can't get better than Erie Shores. We have so much support for our nurses. We have a shocking amount of resources for a small rural hospital. Windsor's close, London's only one call away. So our nurses are very protected and can provide really quality care for our patients while still having a calmer pace and less acuity than a big hospital. So the quality of nursing care is very, very high, and the quality of life for our nurses is very high as well.
My name is Kristen Kennedy, President and CEO of Erie Shores HealthCare. I think as a small community hospital, you really have to be able to stretch your arms around many different programs in the hospital. You acquire experience in the ER, the obstetrical unit, ICU, telemetry, all the different facets of the organization because we are a small hospital and it's important that we're helping one another. I think that experience is intriguing to especially young graduates or individuals that are maybe in the sunset of their career, that you're not in a high-paced specialty unit, but you're in an area where your experience can be spread across many different facets.
My name is Dr. Kenneth Auger. I'm the lead OBGYN at Erie Shores HealthCare. I think one of the major advantages of working here with regards to the culture, we have a collection of managers, clinical leads, and nursing staff, physicians and not physicians, whereby we all work collaboratively in a supportive role. Everybody going over and above what is expected of them. It's like when you start working in the hospital, you get that feel whereby there's open communication.
My name is Lisa Amasey. I am the lead CT technologist in diagnostic imaging. I've been here for about 23 years. To work at Erie Shores, you will never get lost in the shuffle. Everyone counts here, everyone matters. You are given a chance to do your job, to do it well, with a lot of support behind you.
My name is Danica McPhee, and I am the Equity, Diversity, Inclusion, and Indigeneity Coordinator. My favorite thing is that the values of this hospital really align with the community values that I had as a peer support worker. Kindness and compassion. You don't often see organizations that really tout that as the number one priority. It really does feel like people action those values here.
My name's Neelu Saigal. I'm the Director of Interprofessional Practice and Research, and I'm the Chief Nursing Executive at Erie Shores HealthCare. For someone who's been here for 15 years, we have to look at, all of their strengths that they've accomplished in those 15 years being here, and to take that skill set and turn it into a mentorship program so that now they can foster the growth of all of the new grads that are currently coming in. This hospital is a perfect place to start. It's a small hospital. You've got that committed one-on-one care. You've got your clinical teams. You've got managers. The accessibility versus a larger hospital, sometimes, unfortunately, you don't get to see the teams as much. Here, your team is there. They're supporting you. They're checking in.
I'm Dr. Alex Gao, and I'm a hospitalist as well as newborn physician here at Erie Shores. I've been here for 10 years now. We're small, but we're mighty. We have a lot of wonderful staff, but it's still small enough that we're really a team. We work really closely with all of the allied health, with all the physicians, with all the nurses, which is not something that you'll get at a larger hospital. So that was a real big draw for me, is to be able to work in such a tight-knit community and community hospital.
My name's Kyle Schaefer. I'm the Director of Outpatient Services here at Erie Shores. One thing that we try to focus on here at Erie Shores is the breadth of staff. There's so many different staff that make a hospital work, from housekeeping to transporters to technologists to nursing, so many different roles that make a hospital function. And even though they might not be at the bedside providing nursing care, providing clinical care, there's so many great roles and so many great people that work in the hospital that maybe aren't at the bedside but are providing valuable services and testing and imaging to patients, and that's something we don't forget about and that we really acknowledge and respect.
We all know in healthcare that Healthcare workers are working harder and longer than they ever have. At Erie Shores HealthCare, we feel it's really important to help facilitate a proper work-life balance. We take a strong stance on looking at our patient-staff complement, looking at the ability for staff to shut down when they leave after their shift. All of these are important to the staff's mental health and their ability to take care of patients and be focused when they're here at work and be able to enjoy their family when they're outside of the hospital.
I am definitely never leaving this hospital. They might have to just kick me out. I love Leamington. I walk into work every day feeling so proud that I get to work in the hospital that I grew up in and serve the community that I grew up in.